Hello, I'm Dr. Whiting, and today I want to take a few minutes of your time to talk about some of the most common health and diet myths. You see, there's a lot of things that we have come to believe about health and diet that are not exactly true. In fact, the only reason that we believe in these things is because the myth or the story has been repeated over and over again, such as cholesterol and its role in heart disease, diabetes management, and several others. So let's take a look at some of these quickly, and if you find any of these subjects interesting, or if they are of concern to you, I would suggest you check out my other videos in this series on these specific subjects where we talk about them in a little bit more detail. The first thing I want to talk about is arthritis. Now, 100 million people suffer from arthritis in industrialized nations, and all that medicine has been able to do for these people is to come up with drugs that have dangerous side effects, such as Celebrex, Vioxx, and so forth. And of course, these drugs are taken off the market and put back on and taken off again, depending upon how many people get seriously ill when taking them. And we are led to believe that's the only thing that can be done for arthritis. This is not true. There are a great many natural products available, natural nutrients, herbal extracts that are natural anti-inflammatories. A formula that I currently use at our research center is called Inflamease, and Inflamease contains active ingredients that work in the body as natural anti-inflammatories, lowering inflammation, reducing pain, and helping the body to better heal that joint and connective tissue zone. Inflamease has proven, at least in my experience, to be a lifesaver for so many people who suffer from inflammatory conditions. If you are in that situation, you might want to check out my video on arthritis because we go into a whole lot greater detail. Artificial sweeteners, that's another myth. We believe that artificial sweeteners can't make us fat because they don't contain any calories, so we can have all we want. And this, again, is untrue because artificial sweeteners tend to trick the brain into believing we're eating real sugar, at which point the body produces a hormone called insulin, lowers blood sugar, this stimulates appetite, and it makes us hungry all the time. I have been preaching about the dangers of artificial sweeteners for many years, probably 20 years now, and just recently there were 2 clinical studies that finally have proven that people who consume high amounts of artificial sweeteners, especially on an empty stomach, tend to gain weight and have a harder time to lose weight. If you're a diabetic, this particular area is of interest to you. And we're not saying never use artificial sweeteners. We're saying use them A, in moderation, and B, always use them in conjunction with food. Never consume them on an empty stomach. When we talk about diabetes, we're also talking about a situation where we are told or led to believe by medicine that once you are a diabetic, you're a diabetic for life, and there's actually no way to eliminate the problem. This, again, is a myth. It's untrue. Many type 2 diabetics have been able to walk away from their illness completely and control it as if they had no illness at all through a combination of diet, exercise, and the right nutrients. If you have diabetes, I'm telling you, you have a great chance of improving or even eliminating your diabetic problem. Check my video out on diabetes for more information. Fibromyalgia is another condition that of the modern age, and sadly most of the medications for fibromyalgia have tremendously dangerous potential side effects. And all of the medical approaches so far to fibromyalgia fail to realize that these individuals are highly toxic. They have a lot of toxins in their soft tissues of their body, and for some reason that we can't explain, those toxins build up in their bodies and they're unable to eliminate them effectively. And when those toxins rise, the various symptoms of fibromyalgia also increase. At our research center, we've been able to detoxify many fibromyalgia sufferers and improve their quality of life as much as 80% just by detoxification alone. Check my video out on fibromyalgia if you suffer from this problem. What about the infamous low-fat diet? What about that? You see, the low-fat diet has been preached for years as the best way to lose weight and the best way to prevent heart disease. Unfortunately, almost everything we know about fat is wrong. We are told saturated fats are bad for you. Those are animal fats, coconut oil, palm oil, butter, lard. We're told those are evil and they should be avoided at all costs. Well, the truth of the matter is that saturated fats, in moderation, have tremendous heart health protecting factors that are found in no other forms of fat. Now, fat is very high in calories, so I'm not advocating a high-fat diet. About 30% of your calories every day should come from fat, but they should come from quality fats. The best oil to use, of course, is olive oil. Most vegetable oils are very dangerous because when heated or exposed to the air or altered as in hydrogenation or trans fats, these vegetable oils produce free radicals. And free radicals are substances that can do minor and major damage throughout the body. In fact, science has been able to link the free radicals formed from oxidized vegetable oils as one of the major causes of arterial damage leading to heart disease. Check my video out on fats and oils because that is one of the key factors in preventing heart disease, and it's not what you've been told. As long as we're talking about free radicals, let's touch on those for a second. Free radicals are very real. And the only way to prevent free radical activity in the human body, you can't avoid them because every chemical, every toxin, every pollutant in the environment, once it gets into the internal space of our body, has the potential of forming free radicals. The only way you can help prevent that is by consuming nutrients called antioxidants, because antioxidants prevent the oxidation which actually causes the free radical in the first place. What about you ladies who suffer from menopause or who are in the menopause and have the annoying hot flashes, mood swings, night sweats? Now that we know that HRT, or hormone replacement therapy, is extremely dangerous. In fact, the Nurses' Health Study has finally proven that taking HRT is one of the worst things a woman can do. It increases your risk for heart disease, gallbladder disease, and many forms of cancer. Now, I'm not telling you ladies that you should sit around and suffer just because HRT is high risk. There are a host of natural substances, herbs, vitamins, amino acids, that when combined together in the right ratio can actually help the body to balance and normalize hormone production from the adrenal glands. If you've got problems in the menopause, you shouldn't, and you don't need to. Check my video out on menopause in this series and find out how much science has been able to help you naturally to balance your body and live a comfortable, happy life. Cholesterol, that's one of the big ones, and I want to take a minute to talk about cholesterol. If you ask anybody, they'll tell you, oh yeah, cholesterol, that's a big factor in heart disease. In fact, cholesterol causes heart disease. This is 110% untrue. Cholesterol has never caused one case of heart disease in medical history. There are no clinical studies that have ever been able to link cholesterol as a cause factor in heart disease. Cholesterol is a problem much later on in the disease process. Cholesterol is absolutely essential to your life. In fact, levels of cholesterol, total cholesterol, below 150 are actually far more dangerous than high. Because when cholesterol drops below 150, you're at a 10 times greater risk for a stroke. Cholesterol is your friend. Your body manufactures 80% of the cholesterol that you have at any given time because it's so important. Check out my video on cholesterol and find out how you can regulate your cholesterol safely and how you can normalize ratios between HDL and LDL without the use of dangerous statin drugs, which have a whole host of side effects. Calcium. Calcium is the most difficult mineral for the body to absorb, and yet people of middle age and older, especially women, are chomping down these chalky big tablets in the hopes of preventing osteoporosis and bone loss. What you don't understand is that without manganese, copper, zinc, strontium, boron, and magnesium, calcium is absolutely worthless. Check out my video on osteoporosis and find out exactly which form of calcium is the best absorbed into your body. I want to close this video off today and talk about another myth, candida, or systemic human yeast. Now, we are told by the medical industry that this is a myth. This doesn't exist. Well, we know it exists. It's measurable, and fortunately, it's curable or reversible. You see, candida is a naturally occurring organism in the body, but once it breaks out of the intestinal tract and gets into the bloodstream, it becomes systemic. And systemic candida can cause a whole host of problems, from fatigue, digestive disorders, memory problems, skin conditions, adult onset allergies, and so on and so on. And the worst problem about the candida myth is that it's not a myth. That there are millions of people, especially women, who suffer from this condition for weeks, months, or even years. Check my candida video out and take the little test that accompanies that to see if you might have a systemic yeast problem.
Please visit healthyinformation.com or give us a call at 1-888-454-8464.